Hey guys, Dr. Chris here from Acru Health. We are in part 9 of the 12-part series that we've been diving into about these foundational principles of health. And if you go back to the very beginning, we started off with this understanding that your body is designed to be healthy, right? That health is your default normal state, but ultimately what we understand is that there's stresses that we deal with as people. Physical stress, mental emotional stress, and chemical stress that impacts our body and impacts one system in particular, and that is our nervous system, right? That brain, spinal cord, and all the nerves that travel out. And because that system is entirely encased in bone, that spine, the most important thing as chiropractors that we are looking for is what is called subluxations. And subluxation simply, like we talked about previously, is any kind of structural misalignment or structural shift that leads to an interference in the communication from the brain to the rest of the entire body, just like we see up here on this diagram. And so the question becomes, how do you know if you or if your child has a subluxation? And the reality is that when it comes to data and when it comes to science in our medical field, the number one thing we should always be doing is testing, not just guessing. And so if you want to know if you have high blood pressure, they strap a cuff on, you pump that up, and we measure and we check for blood pressure, right? If we want to check for high cholesterol, for example, we get blood work done and we look at the numbers. And so in the same way, when it comes to looking for subluxation, there are a lot of objective measurements that we can do when it comes to that. Okay. Now, one of the most advanced ways to do that is through computerized diagnostic testing. And so that is what we do here in the office, not only on the first visit, whether it's for a brand new newborn in our office, just going through the stress of the labor and delivery process at birth, or somebody in their 30s or 50s or 70s, at day one, we always want to run scans. And so those include 3 different types of scans: heart rate variability testing, thermal scanning, which rolls up the spine, measuring infrared heat temperature differences, okay? And then the last one being SEMG, static electromyography, which is measuring the energy coming off the muscles, looking at more the postural, structural aspects of things, okay? And so when we run those scans, we're able to get very detailed measurements of how things are functioning, and if there is dysfunction, if there is stress that's impacting that nervous system, and if there are subluxations present as a result of that. And so based upon this testing, we have an understanding of what the best care planning going forward is in terms of frequency, recommendations, and then obviously as we go forward, we can monitor and check that progress and see how things are improving as we move forward. So we're not just helping you feel better, which is obviously a critical piece of it because we all want to feel great, but a lot of it is making sure that we are helping you function better, right? Because your body is designed to function at 100%, and that is when you are truly healthy, when everything is working like it's supposed to. And so if you've never been scanned, that is one of the most important things you can do for yourself or for your children to check and assess for subluxation. And as chiropractors, we're the only professionals anywhere in healthcare that are specifically trained to do that. And so if you have never had that done before, maybe you've been adjusted before, but you've never actually had any kind of scanning or had more of that detailed information, that can be the miscellaneous to really making sure that you're identifying where some of the health issues are that you're potentially facing or your children are facing, and how do we actually truly see breakthrough in those areas, okay? So again, when it comes to anything with our health, the most important thing we can do is test, not just guess. And so here at Acru Health, we utilize the most advanced forms of testing to making sure that we are getting you well and keeping you well for a lifetime. Again, I'm Dr. Chris. Have an incredible week.